Hi, it is Thursday, April 9th. I am here at the state capitol with Dr. Janae Caldoun, our chief medical executive here for the state of Michigan. The number of deaths has increased and will continue to increase, and that's precisely why we've got to continue taking this so seriously. So I want to talk a little bit about models of what could happen in Michigan over the next couple of months based on a number of factors. If Michiganders do their part and stay home and stay safe and wear a homemade mask when they do have to leave the house, while they're practicing the other social distancing and hand washing, we can see how many businesses maintain safe work environments for essential employees. That's another factor. And the third factor is the amount of PPE we can get from our own procurement, from the federal government, and from private donations and ramping up here in Michigan to help our essential employees stay safe. These are the factors that go into the models that determine how long we're going to be in this posture. Now, on this graph, the purple line is the IHME from the University of Washington model that the White House has been working off of. That model predicts our peak this week, actually, in the last couple of days. We believe that they're basing their distribution of PPE on this model. It assumes a very high level of adherence with sheltering in place, Wuhan, China style, that is not happening in Michigan or anywhere in the country. So that's one assumption that we think is contributing to this timeline that we don't see happening here on the ground. This model also doesn't represent the reality of what is truly happening, the number of cases, the number of people in critical care, and the number of deaths that we have continued to see rising every day. The more likely scenarios, based on the data that we have seen and what is actually happening here on the ground in Michigan, is the blue and green line on that same chart. Now, the green line is what can happen if everyone does their part. If we act now and we continue to stay at home under really aggressive scenario, you can see that the line will start to flatten. The blue line is what will happen if only some of us observe those rules. And the red line is what would happen without any stay home, stay safe order and without social distancing. You can see that we are in control of our fate here, and it depends on every one of us doing our part. I'll go to just make a couple of observations. These lines aren't just colors on a graph. If we can go back to the last one. They're not just colors on a graph, but this represents people's lives. This represents your grandmother, your child, your sister, your brother, your coworkers. When we all take this seriously, we will save lives in Michigan. We will save the frontline healthcare providers that are struggling to keep up with the need. And we will come out of this in a more robust way where we can get our economy re-engaged. I would like to go to the University of Michigan model that my team and I have been using, modeling that comes out of the U of M. It's helped inform a lot of our decisions as it is based on information that is coming right out of here from the state. This model shows what can happen when all Michiganders stay home and stay safe through May 3rd. That is the blue line. That's what the curve can look like if we stay socially distant through April 30th. The red line through April 13th. So that's what our curve will look like if we stop social distancing now. And the black line is what we would have looked like if we hadn't done it in the first place. As you can see, these actions make a big difference. By observing social distancing, by adhering to the stay-home order, we're going to protect more families, we're going to save more lives, and we're going to help ourselves get back on our feet sooner, which will be better for our economy in the long run. So this has been a hard month. We've got to take the lessons that we've learned from it and use them for the betterment of our state and the betterment of our people. A couple of important observations that we're seeing play out nationally, but we're seeing here right here at home. 14% of our population is African American. Yet over 40% of the COVID-19 deaths in Michigan are African Americans. This virus is holding up a mirror to our society and reminding us of the deep inequities in our country, from basic lack of access to care to access to transportation, to lack of protections in the workplace. These inequities that hit people of color and vulnerable communities the hardest. Over the past 4 weeks, I've signed a number of executive orders to help ensure safety and security of the people of our state, especially focusing on the most vulnerable. So today, I have signed an executive order to extend and expand Michigan's Stay Home, Stay Safe order. Yesterday, Dr. Fauci, who we've all come to see on our television with great regularity, said we need to keep pushing mitigation strategies because there is no doubt that they're having a positive impact on the dynamics of this outbreak. Now is not the time to pull back at all. It is the time to intensify. That's exactly what we're doing. As before, the order limits gatherings and travel and requires all workers who are not necessary to sustain or protect life to stay home until April 30th. Workers who can leave the home for work include those in healthcare and public safety, law enforcement, grocery store workers, public health, and more. All public and private gatherings of any size are prohibited. People can still leave the house for outdoor activities. You need to take care of yourself. Hiking and running, walking, canoeing, kayaking, or other recreational activities are still permitted, so long as they are taking place within 6 feet of anyone else. The order also imposes more stringent limitations on stores to reduce foot traffic and to slow the spread of coronavirus and save lives. Any large store must limit the number of people in the store at one time to no more than 4 customers for every 1,000 square feet of customer floor space. Smaller stores have to limit foot traffic to 25% of the total occupancy limits. Stores will also have to limit and establish lines to regulate entry with markings for patrons to enable them to stand that safe 6-foot distance apart from one another. Michiganders are also encouraged to limit the number of household members running errands to the maximum extent possible. We want them to limit to the minimum extent possible. Unless you have no other choice, your whole family shouldn't be running errands with you. The fewer the people, the better. Big box stores will also have to close areas of the store that are dedicated to things like carpet or flooring, furniture, garden centers, plant nurseries, or paint. If you're not buying food or medicine or other essential items, you should not be going to the store. Your grocery stores will remain open. Your pharmacy will remain open so you can get your prescriptions filled. Your banks and credit unions will be functioning. You can still fill your car with gas. And you can find the full list of critical services that remain open at michigan.gov/coronavirus.
Our team at MDHHS has also been working very hard to analyze data to inform our public health response, but to also make sure the public knows how we are doing when it comes to fighting this disease in our state. We now have new information available on our website on hospitalizations, ventilator use, discharges, and those who have recovered. The data on hospitalizations and inpatient cases will continue to help guide our public health response. As the governor mentioned, we also know this disease is impacting communities of color disproportionately. 33% of cases and 40% of deaths in our state have been in African Americans. We still need to get more robust data, but this is consistent with what we are seeing across the country. If people are disproportionately impacted by poverty, working in lower wage jobs, unable to work from home, needing to use public transportation, lack the ability to isolate sick individuals in their home appropriately, or disproportionately have a higher rate of chronic health conditions, they will be more significantly impacted by this disease. And that's why the measures that the governor has put in place are so important, and why I'm excited to work with the Michigan Coronavirus Task Force on Racial Disparities so that we can tackle this crisis in an equitable way.
So this has been a hard month. We've got to take the lessons that we've learned from it and use them for the betterment of our state and the betterment of our people. A couple of important observations that we're seeing play out nationally, but we're seeing here right here at home. 14% of our population is African American, yet over 40% of the COVID-19 deaths in Michigan are African Americans. This virus is holding up a mirror to our society and reminding us of the deep inequities in our country, from basic lack of access to care, to access to transportation, to lack of protections in the workplace. These inequities that hit people of color and vulnerable communities the hardest. Over the past 4 weeks, I've signed a number of executive orders to help ensure safety and security of the people of our state, especially focusing on the most vulnerable. We've banned evictions and tax foreclosures. We've expanded unemployment benefits. We've taken action to get water restored. And today I'm announcing the Michigan Coronavirus Task Force on Racial Disparities, which will be chaired by Lieutenant Governor Garland Gilchrist. Members of this task force will consist of leaders across state government and healthcare professionals from communities most impacted by the spread of coronavirus. The task force will start meeting this week and will be charged with providing recommendations on how to address racial disparities in healthcare during the COVID-19 crisis. Members of the task force will regularly gather feedback from within impacted communities. Now, this is a start, and we're going to continue to keep running. I talked about moms and babies during my State of the State and disparate outcomes in healthcare. It should not have to take a crisis like this for us to really address this. But here we are. It is an opportunity to examine it, to understand it, and to do better. It's an opportunity for us to expand unemployment benefits, or perhaps paycheck protections, or protections for workers who are sick, or ensure access to quality, affordable health care. We're going to come out of this, but we have got to come out of this smarter, having learned some things from this tough moment about the deep problems in our economy that we need real, meaningful solutions on. We're working around the clock to help those who are still trying to navigate the technical issues in filing unemployment. The UIA has nearly quadrupled staffing levels over the last several weeks and has extended call center hours by an hour every day, 8 a.m. to 6 p.m. Monday through Friday, and remains open on Saturdays, 7 a.m. to 2 p.m. The last 3 weeks, from March 15th through April 4th, Michigan has seen 816,785 total claims. We know we're not alone in this high unemployment. In fact, every state in the nation is confronting the same thing that we are. 6.6 million Americans in the last week alone have applied similarly. Compared to the 3 weeks ending February 29th, March 7th, and March 14th, prior to COVID-19, this represents a 5,000% increase. I'm committed to making sure that every eligible Michigander receives their unemployment benefits. I appreciate your patience.